Good morning and welcome to our virtual launch of the Healthcare Forum 2022 that is being planned for, um, you know, bringing together stakeholders around the public sector, the private sector, the Ministry of Health, our regulatory agencies. The Healthcare Forum is a place where people can come together and talk about the issues that affect all of us as patients, as family members, as institutions. The Healthcare Forum was founded by the Nyaho Dove Foundation, the corporate social responsibility arm of Nyaho Medical Center. And it's my pleasure. My name is Eli Kemp Tamaklo. I am the managing director of Nyaho Medical Center, and it is my pleasure to welcome you all to this official launch. This year, we are trying to do something different, and we're trying to continue to adapt and present information that is useful and that creates an impact. And so we have organized a series of small talks leading up to the Healthcare Forum, which will be happening in March next year. And so for us, it's an exciting experience, it's an exciting journey, and I hope you will join us and listen to some of the great speakers that we have lined up. We believe that as we learn and open our minds to hearing these different perspectives, we can also reflect on our own experiences and our personal roles, the roles that we play in tackling the issues that we face. We have as our theme for next year, preparing for the next pandemic or the next healthcare emergency. As we know, we have been through a very difficult time globally with the COVID-19 pandemic. So much has been shared, so much has been discussed, but we have to be mindful that this is not going to be the first. We've had many pandemics in the past, but this will not be the last pandemic. And as we start to breathe again from the whole impact of the emergency situation, we need to start shifting our mindsets from emergency responsiveness to disaster preparedness or emergency preparedness. We see that there is an opportunity that we can ride on the foundations set by this recent pandemic and build upon it so that we can emerge as a stronger healthcare industry. At Nyaho Medical Center, we have always seen ourselves as a part of the community, but we realize that we cannot do this by ourselves. We need to engage. We have to move beyond our walls and have a dialogue, have multi-sector players talk about the different things that they are seeing and that they are doing. And when we are able to piece together this complex puzzle, we believe that when we come up with solutions, these solutions shall be fit for purpose and shall translate to the impact, which is saving lives and improving the quality of life for our people in Ghana and beyond. So I am excited, and I hope you are too. I would like us to see a few seconds, a few minutes of some of the work that we have done previously in a short video. And we'll be sharing that shortly. So please have a great time. Enjoy the next few minutes of our past experiences. Great. And thanks a lot for joining us as we reflected and we saw all the different experiences that we've had since this started. We've had amazing speakers along the way. We've had people who've been healthcare operators who've talked about challenges that they faced and how they've overcome these challenges. Examples are from Lagoon Hospitals in Nigeria, where we had Dr. Aoyemi, who's the quality director, who talked about their accreditation journey through very difficult times. We've also had the likes of Dr. Biju Mohandes, who was from the ISC, talking about healthcare financing, because healthcare financing plays a significant role as we strengthen our healthcare systems. And we have had innovators like Gregory Roxon, the CEO of mPharma, who's talked about how innovation plays a significant role in driving healthcare access to the least and those who have very little when it comes to quality medication and quality healthcare. I could go on. The list continues on and on. And I think that the video was to help give that sense of excitement, because what we have learned is that it takes a whole number of people to really strengthen the healthcare industry. So I'm very excited for our next guest. Our first guest for this series is one of the most pivotal or critical players in the COVID-19 pandemic response in Ghana. I'm privileged to be welcoming Professor William Ampofo, who holds the position of Associate Professor and Head of the Virology Department of the Noguchi Memorial Institute for Medical Research at the University of Ghana in Accra, Ghana. He is very accomplished and holds research fellowships at the Institute. He has headed its Department of Electron Microscopy and Histopathology, and his work has focused on molecular and serological investigations of viral infections and antiviral interventions. So a lot of scope here. He has served on many boards, and he is a member of the academic board at the University of Ghana's College of Health Sciences and of the Ghana Field Epidemiology and Laboratory Training Program Steering Committee of the School of Public Health. He has also participated in the National Steering Committee for International Health Regulations at the Ghana's Ministry of Health, and it's in the ministry's National Technical Coordination Committee for Ebola virus disease. He is also a member of Ghana's National Ebola Emergency Operations Center. Professor Ampofo has been a temporary advisor and consultant to the WHO, including in support of the Ebola response, and is a former member of the WHO's Strategic Advisory Group, SAGE, of expert working group of experts working group on influenza vaccines and immunization. And he also recently chaired WHO's Pandemic Influenza Preparedness Framework Advisory Group. He is a member of the WHO Global Action Plan for Influenza Vaccines Advisory Group and also an advisor to WHO IHR Emergency Committee for EVDs. And I think that he'll be talking to us on just his lessons learned, especially when it comes to this most recent pandemic, COVID-19. He has had many experiences, and he'll be sharing some of the lessons learned. But also, as you can tell from his experiences, he has had different engagements during the Ebola crisis. And so there's lots of lessons we can learn. As he prepares to come into the room, I just want us to also remember that when it comes to the discussions that we'll be having, this is not meant to be just sharing ideas, but we really care about how these ideas translate into practical steps. We want to see how these ideas translate and create solutions that are fit for purpose. Because especially when we look at the pandemic that we've just been through, if the systems do not work, it ultimately results in loss of life. I personally have seen so many people who had their lives ahead of them, and it was too soon cut short because of the limitations of our healthcare system. I know that many people have been affected by COVID-19, either personally through their family members, or even its impact on businesses and the economy. Some people have lost their lives. And so we have to be serious around our involvement, our engagement in the discussion. And as we start to foster the discussion, we hope to create forums where we can get your feedback and your thoughts as to how do we move forward. And so it's not just for the Ministry of Health, it's not just for healthcare operators like ourselves at Yahoo in the private sector or the Ghana Health Service in the public. It's also going to be about how patients themselves can be empowered and really help drive some of the miscommunication and misunderstandings that come during times of crisis. So I'd like to just see if Professor Ampofo is on the call. He has just joined us out of a busy schedule, and we are very privileged to have him. I know that there were a few technical challenges, but I'd like to just see if it's possible to have you welcome yourself. Professor, welcome. So I think there might be still some technical challenges. So what we'll do now is probably talk about what the next few months have in store for us. So we will share a slide right now to let you know what's expected, and we will hopefully be resolving our technical challenges and get a good conversation going. But I'd like us to share right now slides that will highlight what we can expect from this forum, this healthcare forum. This is October 21st, where we have our first conversation, but we look forward to having a few more conversations in the following months. So we have November 2021, next month, where we will be inviting a few other members of the COVID-19 response team to share some of their lessons learned. And then this will be leading on to a monthly rhythm, a monthly conversation until we get to March 2022. So I'm excited. I think that we will be hopefully sharing more information as we go along. Great. So I'm not sure where the slides are. So we will also, I think we will probably be taking a short break so that we can resolve any of these issues. But please bear with us. This is going to be a journey. And like any journey, we actually are excited about what it holds for us. I would like to officially start and welcome you all and then say that this journey has begun. It has begun a long time past with other people, but especially for us here at the Healthcare Forum, it's going to be an exciting journey. Thank you. So welcome back. And unfortunately, we've been having a few technical challenges connecting. I think especially as we have so many things that are ongoing, sometimes this is a good lesson for us to start looking at how we can get some of these challenges resolved when they happen. Unfortunately, we've had a number of attempts and it's not working. So we definitely want to rearrange and get a time where we can actually sit down and not be rushed because what Professor Ampefo has to say is really amazing. It's really amazing because of his breadth of experience in the country, and also his advisory work in terms of other countries and some of the strategic initiatives that are happening around preparedness. So I think that with pertaining to this conversation today, the key focus was to launch this series that we had started. We were looking forward to actually having a good discussion, but I think that for our next conversation, we definitely will look forward to having even more so a focus on something that will be more impactful and without too much rush for time. We appreciate you taking time out of your busy schedules for today, and we really appreciate you joining us on this journey. Our website is listed in the video that was showing. And we also have a number of Twitter handles that we would ask and hope that you would start following so that the conversation can be ongoing as we ramp up for our event next year. So just to repeat again, the Healthcare Forum will be taking place next year in March 2022. It will be a hybrid, a physical and virtual experience. And we're actually excited to be working with a few partners to make this possible. And I think that pertaining to the run-up, every month, look forward to a discussion on a specific topic. Doesn't take a lot of time, but something that will help us as we start thinking about what we need to do for the next emergency, so that we do not lose face. We are able to just ride the waves and ensure that we can save lives and save and improve the quality of lives in our country and beyond. Thank you very much again for your time. My name is Elikem Tamaklo. I'm the Managing Director for Nyahu Medical Center, and it's my pleasure to officially welcome you to this journey, launching our Healthcare Forum 2022. Thank you and have a good day. Take care.